All right, welcome to the Rule Breaker Studio. We're so excited to have you here with us today and really enjoy and bask in your story. So, with that said, Dr. Graham, I'm going to let you take the floor. Tell us a little bit about yourself, and then let's walk this journey.
Okay, sure. Thanks for having me. So, Nikki Graham, and been in nursing about 35 years. I used to say 30 years, and the other day I did the calculations, and I was like, I'm way off. It's been a while. So, but only in leadership for really about 12 years. I was one of those nurses who was like, I'm not going to be a leader. I don't want to be a leader. And so here I am leading. So I'm a vice president for nursing practice, which I love. And not really, when we say nursing practice, not really all of the guidance and rules and regulations, but actually like really being able to affect the sacred space between patient and nurse, right? So what really happens in that space, that's what I get to focus on, because there's a team who focuses on the other stuff. So dream come true, right? And I also have Innovation Hub, and just recently all of our education for our system. So super fun. All of the pieces that I love. So my past started out, mostly as an ED nurse. So rough around the edges in a big ED center. Was really fun. Grew a family who's still my family to this day, right? And then went into leadership reluctantly through education. Worked across the country in academic medical centers across the country, and found myself here in the Midwest. Originally from the Pacific Northwest, very much a Pacific Northwest girl. So, yeah.
Okay, so I love the dots that you've aligned here, the innovation, the education, and the practice change. I can't even imagine, and I'm gonna be excited to hear you speak about kind of how you've fused those together and the opportunities that have just come out of that, and how you really have educated yourself to be able to support all three of those things in one role.
Yeah. Well, before we get started, it's important to know that I have like the world's best directors. I'm pretty sure. Anyway, I lead really flat. Yeah. I lead really flat. So my directors are amazing. They really know what they're doing. I defer to them. They all know more about what they do and their specialty than I ever will. And that's really beautiful, right? So my job is to remove barriers, to empower, to be able to like kind of blow in their sails and get them going. So I try really hard not to get in the middle of their work, but to understand what they need from me. So that allows for a lot of fun things. Innovation is a little different. We're brand new, bringing up the Nursing Innovation Hub about a year and some change. And so I've been having a lot of fun with that. And at some point, I'll probably move that over to one of my directors. But I love building. So I would be miserable in a job where I came in and had to do the same thing all the time and just maintain something, right? I need to build and pass on, build and pass on. And if I don't, I get bored. So sometimes I'm like, I'm so busy. And then I'm like, but I've done it to myself.
I think you're our spirit animal. You're our spirit
animal. Yeah, exactly. So Innovation Hub has been super fun. This is the first organization I've worked at that has a really robust innovation center. And what was lacking was a coordinated nursing innovation hub. And so I got the privilege of really starting that without much definition on what that would be, which is my favorite. So so things came together at the same time. I'll try to explain how the worlds collided in the Big Bang that became a nursing innovation fellowship, right? There's lots of pieces. So ED nurse, but also I always say I was one of the 2 ED nurses in the United States who loved our behavioral health patients. So love behavioral health, love psychiatric nursing, got certified while I was in the ED in psychiatric nursing. Love to think about behavior and about what motivates people right? How we get people to move and change their behavior, which is really applicable in practice, right? Because in nursing practice, we get really comfortable with our practice. And how do we move? How do we move practice along with the speed of change and the speed of need, right? So that's really what I spend a lot of my day thinking about. Yeah. So anyway, where was I? I get lost.
It's okay. You're talking about the big bang. How you
Oh,
bring
right, the big bang. Okay.
Yeah.
See, isn't this fun to be a director for me? You're like, okay, let's go back to what we were talking about. Okay, so I got to start the Innovation Hub, and that was really, kind of not poorly defined, but purposefully just open, right? We have innovation. We've got these people who can help support you. We want you to collaborate with universities to solve nursing problems and to, collaborate with upstarts and create, either products or technology and come together and really solve nursing problems. And here are all these resources, right? Grants, this, that. And I was like, ooh, how fun. So that was happening at the same time. In my psychiatric background, I really knew about peer support, peer coaches, right? And how effective that peer-to-peer is. And then we were doing a big implementation. So I know this is the same across the United States. After COVID, we really expected our outcomes to bounce back, our quality and our patient experience and all of our outcomes to bounce back. And they didn't, not really, a little bit, but not really. And so we were like, what is going on? And so I needed a team. I had a small team, but I needed a bigger team to really look at what was going on in nursing practice, to really understand at the nursing view, right? The people who actually provide the care, to really understand what was going on and how we could affect change and get our outcomes better. And part of that was working directly with nurses, right? I have a strong belief that the day you step off the unit or the care setting, you no longer understand what's going on. The change of care is so fast that even if I was practicing last year, it's changed. I can't assume that I know anything anymore. One of my pet peeves is when I have nurses who say, well, in my day, I had 12 patients and this is what it was like, and this is what it was like. And I was like, ooh, do you know the acuity and the progression of care? And like those patients, some of those patients don't even come into the hospital anymore, right?
Right.
So the patients that are in the hospital are really, really ill, and we're moving fast with them. And so it's just different. And so we need the people who are really doing the work to solve the problems, right? We know that. The ANCC has been telling us that since, 1990s. So anyway, I was gifted 6 nurses, 1 shift a week. So they were still on the unit 2 shifts a week as float nurses across the organization. So they really could see and know. I was gifted 6. So we put the word out and said, this is where it got really fun. Hey, we're going to do something. I don't know what, but it's going to be really cool. And I want you to apply. And by the way, if you write me this 1,000-word essay and you apply and go before a panel, we're going to do an innovation where you get to learn about innovation and you get to learn about coaching, and you're going to go with us and help us change nursing practice. And I had 18 applicants, which was really surprising because that's a lot of work, right? Yeah. I had 18 applicants, and they were all so eager. And when they would ask me questions and I'm like, I don't know. We're going to, build the plane while we fly it. They're like, okay. And I was like, you are my people. We're going to do this, and we're going to create something really fun. So I had a 5-nurse implementation team that's really steeped in implementation science, design, and implementing, right? But we were going to go in at the elbow, and we have 57 med-surg units across our organization, and we have targeted to do 30, and then for those local places to spread, right? So we would go in and do 1 to 5, depending on how big the facility was, and then they would spread to the rest with all of these design changes. And the design changes were just foundational nursing. What we found is that nurses were really, really busy. There were efficiencies that were really easy to hand them. I'm a strong believer, and I will not you to do one more thing until I give you the time to do it, right? Will not. Yeah. So we built some efficiencies in documentation, in medication delivery, and just some of the places where we just saw some time drags when we walked alongside with the nurses and when they talked to us about what was going on. So we created some efficiencies there, and we went in at the elbow. But to get the innovation fellows ready, we did two things. We gave them a coaching curriculum to get them ready to really peer coach and to understand peer coaching. And so that was for implementation. We got them ready. But then I thought, wouldn't it be really cool if not only while they were coaching, they were really thinking differently and challenging the way they think while they're on the unit and coaching and at the elbow with the nurses. So the innovation, the big innovation hub offered us courses. And so we designed an 8-week course where for 8 weeks we paused implementation, and once a week they went to school and got their minds cracked open and like wildly thinking differently, challenging their beliefs, right? Really challenging how they think. When we went to implementation, back to implementation, they were out coaching, but they're also thinking, what is broken? How can we fix this? What doesn't make sense? What is draining us? And so that is our implementation, our innovation fellowship. It's 6 folks who've been doing it a year. And many of them say it's the coolest thing they've ever done, that they really love it. And actually today, a little bit later today, I'm going to our council to ask if we can extend them, our workforce council, if we can extend them another year, because implementing across the organization like that, we've decreased our safety events by 51% and increased our patient experience by 20 points globally.
That is awesome.
Yeah.
So you said a few things that I just have to highlight. First of all, you started out with your reluctancy to enter leadership, but then you said all of the things that is leadership, which is hire smart people, get out of their way, and just make sure they have what they need to do their job. Right. So it's no wonder you ended up in leadership. That's the definition. Build other leaders. The other thing you said that I really loved is the people closest to the job are the ones with the solution. Yeah. I mean, that applies in all industries, all across. We can't have people making decisions that don't actually understand the work. And it's so true. I'm very intentional to stay embedded in the system because I'm out there talking about leadership practice. I can't speak to what I did 15 years ago. It's not relevant anymore. So you have to be able to do that. So I love that. And I'm really intrigued. You're in the right crowd because Alyssa and I are the people that are like vague. We don't know what we're doing. Jump right in. All on. But I really genuinely believe in the peer-to-peer learning. There is nothing more powerful than the community, the network. That really is where it's at. I mean, it's great to have mentors and the wisdom, all of that, but it really does come from that peer-to-peer. So, but I'm really curious about this coaching curriculum. Did you develop it or?
I did not.
Where does this come from and what are like the key takeaways from that? Because that's so critical.
Yeah, sure. So our organizational development is really great. I actually partner with the director of OD a lot because she and I come together for education quite a bit, right? So, and she's really dynamic and a lot of fun. And so they have a curriculum called Support Coach Support. And it's usually for leaders, right? On how, managers and stuff support. But I asked them to do it for patient fellows. And it included simulation, right? Where they practiced and everyone, their peers watched and then gave feedback and they all took turns. And, I was blown away just because nurses are really good at talking to people and coaching people anyway, right?
Yeah.
This is what we do all day long. But they did fantastic, but they got even better. And to see them on the units coaching their peers, it was amazing. But yeah, that curriculum came from our OD, and it was really effective. And so we actually ended up taking that ahead of our implementation to the charge nurses that were ahead of us where we were going, to get them ready to really lead, because the charge nurse is, one of the most important jobs on the unit, right? They're an extension of the day-to-day leadership. And if the charge nurse doesn't buy into the change, then you might as well just walk away now.
Oh my gosh, you nailed it. Because it's that frontline leader that is the biggest barrier. And it's not because they don't want to. It's just, that's more change in a system where I'm already overwhelmed,
completely overwhelmed. And I'm trying to protect the nurses that are just trying to get their work done. Right.
So I want to connect something that you said when I'm listening to you, the outcomes and what you've done. I really think about how powerful it is that you've translated a very key construct of being a high reliability organization into how you can take that and really transform how nurses are part of an HRO, right? Yeah. Because I think that there's a big gap in we talk about tools and ways that we become high reliability organizations and health systems, but there's a breakdown in how that translates to the point of care. And I think, just hearing, I know when I think about high reliability, peer coach and check, right, is a huge construct of that, and how you help make sure that things are safe for the patient, things are safe for the nurses in their work environment, and giving them those tools and the training to be confident in how they're able to coach alongside their peers. I mean, I just can't, I hear the impact, and it's just gosh, if you could spread that, really across all systems, how would that have such an impact on moving toward that HRO ideation that we have in health systems. So I just wanted to call that out, because I think it's just a phenomenal way of how you've kind of put those pieces together.
We're going to bring on 7 more. So I'm excited about that. And then the second year, the Innovation Fellow 2s, they are going to get some dedicated time to work in innovation. So that's pretty fun with the innovation team, to come up with an idea and work on innovation and pull in some of their other peers, right, that aren't in the Innovation Fellowship to work through some problems. So I'm excited about it. It's really fun. It brings me a lot of joy.
Yeah, I can imagine.
The people that are accepting this role or applying for this role, do they have a certain level of experience? And I ask this because after you've been in it a while, we normalize things that are not acceptable. And so what is the background of the people that get in?
Yeah. Our first group we took from the float pool, and we did a number of things. First, we had them apply, but we also had their leadership sort them out by things that show that they care. Right? They're involved in shared governance. They know their own personal impact outcome data, right? They're always the one that says, yes, I can do this, and yes, I can do that. So that was the first layer. The second, they also had to get a recommendation from their CNO. And but most of them had somewhere between 3 to 10 years of experience. Yeah. And so, because we needed them to be at least proficient, and preferably, around expert, for their peer buy-in. Right. Yes. Yeah. And so I think it would be fun to have someone with less experience for them to go in and create some innovation, materials that are part of the transition to practice program, so that when the nurses go in, they challenge a little bit more, right? Before, but it's been, we've been able to really push the thinking of these nurses. And so, yeah.
I think what you've just said about the marrying them with the transition to practice, because they're supposed to do their evidence-based practice project, and that is the barrier. It's this new person's coming in, why am I going to listen to them? But they see it with a new perspective. And if they had that partnership with someone and I love that it's all about their values. That's how they get in I genuinely care and I'm trying to make a difference. So I think that that's critical.
Yeah. It's been really uplifting to realize how many nurses at the bedside really, really want to give great care. That's been so, because the pandemic kind of beat us down a little bit. And it wasn't a very joyful time in nursing, right? So to get back out on the unit and watch all of this change has been really, really enlightening, uplifting. It's been really great. The nurses have embraced the changes that we brought to them. It's been amazing. Yeah, we thought we would get resistance, but we really didn't. Not with their coaches and being able to say, the why and say, we do it this way all the time too, and this is what we've found is helpful. And
I like that.
Yeah.
I think that's so impactful. So I want to thank you so much for sharing this story. I can't imagine like being a nurse and hearing that this exists and then applying to work anywhere else. So I think if nothing else, it's such a great story to be able to bring in like good people, to your organization and be able to support them as they grow, and then better foster like just that work environment, right? Where you feel like you can really come in and like make a change and make a difference. I would have given a lot for that as a nurse, at the point of care. So you are on the rule breakers though. And so I know I am looking at the ultimate rule breaker right now. So I would love to hear if you could break any rule in healthcare, what rule would you be breaking?
Yeah. So I thought about this a lot because I was like, just one? Just one rule? I have a list of 100. So the one thing that I think I would break is that healthcare leaders are responsible for changing healthcare. Right? We have got to think outside the box and partner. One of the things that I've gotten to do with innovation, the Innovation Hub, is partner with contextual engineers, which I think is the second coolest job in the world to nursing. And this is why contextual engineers think about how people interact and how their behavior changes with technology, right? Super cool job. It's like sociology meets engineering. And so we've been able to work with them and bring them in to walk alongside nurses to understand, to help us start thinking about how to improve belonging. How do we improve belonging? What's missing, right? What can we infuse into their day to help them feel, not only big T team, little T team, all the way down. And so, and when I listen to them talk about their frameworks and models and the way that they do their work, I really understand that unless we partner with people outside of healthcare, we're not going to get to the solution. We need our nurses at the point of care, all clinicians at the point of care, partnering with people outside of healthcare to really reimagine what this should look like.
Yeah, I like the concept of, because you see a lot of companies out there trying to do it without clinicians. But the same is true. Clinicians are trying to do it without the knowledge from other industries, and to collaborate could be very powerful.
Yeah. In challenging times, right? This is new challenges for us. So we need to challenge ourselves to be new.
Yeah. Love that.
Yeah. Okay. So Nikki, if anyone wanted to reach out to you after hearing this podcast and learn a little bit more, where's the best place for people to connect with you?
They can email me. I'm on LinkedIn.
Okay.
Yeah, I'm on LinkedIn. So that's a really good place. I'm on LinkedIn and I look at it almost every day. So message me on LinkedIn or send me a connection and a message, something. And I'm happy to connect with anyone.
Okay, perfect. And I'll include your link, if that's okay, in the show notes.
Yes.
So anyone who's listening that wants to connect with Dr. Nikki Graham and talk all things innovation, you can go look there and you can find her information. So again, I want to thank you for the gift of your time, and truly thank you for the work that you're doing. I think, I will continue to follow you and see how this continues to amass, because I know it's going to continue to lead to great things. So thank you so much for sharing this work with us on the Healthcare Rule Breakers.
Yes,
thank
welcome
you
to the club.
Yeah, thank you. It's been really fun.